I first want to say thank you all for joining me in this diversity training presentation. For those of you who may not know me, my name is Gabriela Madera Pena. Today, I will be informing you about the disability ADHD and what it is and how this information can be useful in a workplace. Imagine a workplace where every person's unique talents are not just recognized, but celebrated. A workplace that embraces diversity in all its forms, including those with mental disabilities such as ADHD. In our discussion today, we will be discussing the history background of ADHD, data and information about ADHD, positive and negative stereotypes of ADHD, workplace communication with ADHD, and ADHD impacts in a workplace. To begin, let's discuss the background of the mental disability ADHD. ADHD stands for Attention Deficit Hyperactivity Disorder. ADHD is a neurodevelopmental disorder, affects both children and adults, characterized by persistent patterns of inattention, hyperactivity, and impulsivity. Typically starts in childhood, appearing before the age of 12. The exact cause of ADHD is not known. Research suggests that it likely influenced by a combination of genetic, environmental, and neurological factors. Next, let's discuss ADHD data information. According to Forbes magazine, over 84 million are affected by ADHD globally. ADHD is among the most common mental conditions in children, with an estimated 6 million children ages 3 to 17 years having ever been diagnosed, according to the Centers for Disease Control and Prevention, CDC. ADHD is more commonly diagnosed in Black non-Hispanic children, 12%, than white children, 10%, Hispanic children, 8%, and non-Hispanic children, 3%. As we continue, let us discuss the cultural values of ADHD. The first one being awareness and understanding, the second one being stigma and acceptance, the final one being treatment approaches. Next, let's take a look at the stereotypes of ADHD. So there are two different stereotypes here. We have positive stereotypes and negative stereotypes. So let us begin with the positive stereotypes, which are creativity, out-of-the-box thinking, energy, and enthusiasm. And then we look at the negative stereotypes, which are hyperactivity, lack of focus, and disorganization, and inattentiveness. Did you know that males are almost 3 times more likely to be diagnosed with ADHD than females? And the average age for an ADHD diagnosis is 7, but children with more severe ADHD are more commonly diagnosed at a younger age. Let's look at some workplace communication. Superior, set clear expectations and deadlines. Subordinate, maintain structured and organized work environment. Lateral, encourage active participation. Let us look at verbal and nonverbal workplace communications. Starting off with verbal, be clear and concise, use visual aid, repeat and summarize, encourage questions, and provide specific instructions. Now moving on to nonverbal workplace communications. Maintain eye contact, use gestures and body language, be mindful of tone, minimize distractions, be patient and understanding. As we continue, let us look at some additional workplace communication, starting off with interpersonal strategies and skills, time management, flexibility and accommodations, positive reinforcement, problem-solving conflict, active listening, clear and structured, empathy and understanding. Now let us look at concepts of working in teams, clear roles and responsibilities, open and transparent, and finally, task breakdown. As we move forward, let's look at workplace communication, workplace relevant customs/traditions. With our first one being workplace reasonable accommodations, often tend to move around or stay in one spot for a while. Quiet workspace. Let us look at some workplace communication facts about ADHD. The workplace is one of the most common domains of life in which adults with ADHD have significant struggles. There are effective medical and non-medical treatments for adult ADHD that can help workplace functioning. Adults with ADHD typically struggle with focusing and staying on task during work. To conclude, I would like to summarize my main points. The first one being what ADHD is and its effect to people. The second one, ADHD data and stereotypes. The third one, communication strategies when talking to people with ADHD. The fourth one, what you can do to make it easier for people with ADHD. And the final one being what to expect when working with people with ADHD. For my final concluding thought, I would like to remind y'all to remember each person with ADHD is different, so it is important to approach workplace communication with an open mind. For my last slide, these are my works cited.